and welcome to my channel. So today what I'd like to talk about is treating trauma through acupressure, acupuncture. I thought it would be a good time to talk about trauma right now because this is coming up for a lot of people. These are very interesting, intense times. We've all been worried about getting sick, whether we still have our jobs or our business. We may have had friends or relatives in a hospital for any number of reasons. We haven't been able to go visit them. People just not being able to receive the treatments that they've needed because they can't go to their doctor or the hospital. And it's just been so heartbreaking hearing about people's relatives dying without anyone there to visit them. And we don't really know what's coming next. The countries are starting to open up a little bit, but we can't even really be sure what's even true sometimes with what's been going on in the media. So for some, this mental and emotional material is really hitting a crisis level, and it partly has to do with being in lockdown and isolation for so long, and then on top of that we've got the rioting in the States, as if there wasn't enough to deal with already. So what's good to understand is that when something traumatic is going on in the present time, it can often be a trigger to reactivate old trauma, traumatic experiences from the past. Now, before I go on too much about that, let's get right into a few key points that we can start working on while we're watching this video. So you can start practicing and just see how it's working for you. So here's a picture of a set of points called the N.A.D.A protocol. These are 5 points on the ear that have been used, quite substantially since the 1970s, but they do go back to research in China going much further back in time. In any case, they've been well researched for the beneficial effects in healing trauma. Specifically, they're known in their use with veterans with post-traumatic stress disorder. So here are the points. We've got the Shenmen point, we've got the parasympathetic nervous system point, the liver point, and the lung point. Now, the acronym N.A.D.A stands for National Association of Detoxification Acupuncture, and I am trained through them in this specific protocol. And so what you can do with acupressure is you're just going to squeeze on these points between your thumb and your index finger. And what I like to do is I just like to move, from the top of the ear down to the bottom, just working through the points in kind of an order, and then going back up to the top and squeezing all the points going down to the bottom. Some acupuncturists will put press seeds on these points. If you have press seeds and you have someone who's willing to place them on your ear, then that can be quite helpful rather than trying to find them yourself. I recommend doing this treatment several times a day for best results. Each time we do the acupressure, we're basically telling the body to make its own medicine and helping that to happen by stimulating these points, which tells the body to perform the functions that each of these points do. So this protocol has been used quite successfully with all kinds of addiction issues, from opioids to overeating to smoking to alcohol. Even it's been used successfully in children suffering from seizures, autism, ADHD, and the list goes on. Now, one of these points up here called Shenmen, this has been studied quite extensively because it is known to help the body produce its own opioids. And that's how it was used in China back in the 1800s, helping people overcome opioid addiction in China. So that's kind of how it started with this point here, Shen Men. So we can help our body make its own opioids. Now, one good thing coming out of all this this very strange time in human history is that it's given many of us a chance to go inwards. When have we ever had so much alone time? Maybe through being alone, we've had time to start thinking about our world in a different way as a result of processing what's in our mind. Maybe we want things to go back to normal. We want to feel like we're human beings again, and maybe for other reasons, we kind of like our new reality, a chance to get away from the 9 to 5, the 2-hour commutes to work, the competitive workplace, the superficiality. Maybe we've been enjoying sitting at home and eating home-cooked meals and doing Zoom meetings in our pajamas. And in some ways, we can say maybe this has been kind of nice. So what trauma does is it can put us into shock. What shock does in an Oriental medicine perspective is it scatters the mind. So we were talking about the more subtle aspect of the mind, which some would call the spirit, and it causes this subtle aspect of the mind to actually leave the body, if only partially. I've known people that have had to go through public speaking, which they were terrified to do, having all these sets of eyes gazing at them while they spoke, and having these partial out-of-body experiences. They're still in the body, but the mind is there's a feeling of disconnect, as if there is someone else sitting there doing the talking, someone else sitting there in that chair publicly speaking. Okay, so because the mind was partway leaving the body, or what we could call scattering of the Shen, and for some people experience it more fully. This is actually a classic response to a traumatic event where people completely shut off. They have almost no memory of the event. And after the event, they begin to disassociate. They have these experiences of total disconnect. And so this all has to do with the subtle mind, or the Shen, leaving the body at the time of the event. It's kind of a protective mechanism, but it does leave these symptoms. So when a person is in shock, this can come from experiencing the actual event or being a witness, seeing the trauma happen to someone else. Even just hearing someone tell a story about such an event, such as watching the news, can also leave us with some trauma. So one of my biggest tips for dealing with this kind of trauma is to be, especially right now, be very careful what kind of news stories we are exposing ourselves to. And I know that's hard to do lately. We've had to pay attention to what's going on in the news, at least locally, with the lockdown. And yet there's been a lot of terrifying news. And so this is where I hope now, as the situation is easing up, that we can start to take a step back a bit and think about, how much of this scary news do we really need to take in? And if it is creating shock for us, it's time to think about, do we have some resources available that can help us cope with the information? And I think also just limiting the amount of exposure that we're going to have to this kind of news or storytelling that is coming into our ears and eyes. So just using a little bit of wisdom and thinking, do we have people to turn to, people that we can lean on for reassurance or support? And do we have places we can turn for positive news or for a heartfelt connection that soothes us? And, how are we creating a sense of safety for ourselves in our lives right now? Now, the memory of trauma is an important thing to treat because it's often both our conscious memory, and more importantly, the subconscious memory that can be very powerful because we're often not aware that our reactions are being triggered by memories that are held in our subconscious. So these subconscious memories can be activated by current events. The subconscious is harder to work with, but by bringing in some kind of somatic therapy, such as a body work, acupuncture, acupressure, emotional freedom technique, also called tapping, polarity therapy. There are many, many kinds of these therapies, and they are helpful, and some would say essential, because often our unconscious material gets held in the body. It gets stored in the muscles with what we call a muscle memory. And so this helps us understand the expression, the body never lies. So this means that, we may have trouble telling our real story, getting to the root of what's really bothering us, or the root of our symptoms, because it's hard to access the subconscious material. It's been pushed out of our conscious awareness, but the body stores this memory. And the body may express this memory in symptoms or pain that we've had for years, and so far have not been able to get to the bottom of it and fix it completely because it's connected with an unhealed trauma memory. Now, of course, when we talk about trauma, we're probably very familiar with post-traumatic stress disorder, which is a cluster of symptoms that may happen following an intensely traumatic event. But it isn't always in extreme situations of war, like we often hear about combat situations with soldiers causing PTSD. It can also show up in any number of circumstances, including a frightening medical diagnosis, a car accident, a divorce, a bankruptcy, a failure that changes our life in significant ways, a birth trauma, natural disasters. And it also isn't necessarily a one-time event, as in the case of what's now called complex trauma, or c-ptsd, which are coming from more continuous, long-lasting traumatic circumstances, often in childhood, where there wasn't much chance of escaping. So in the case of child abuse or a domestic violence situation, post-traumatic stress disorder is a mental health issue that's triggered by a deeply frightening event, either experiencing it or being a witness, and it can show up as nightmares, flashbacks, severe anxiety, as well as intrusive memories in our daily life about the event. After the event, there can be a period of difficulty coping, which eases over time and with good self-care, but if it carries on for months or years, causing interference with daily functioning, then we may have unresolved trauma. So the reason these trauma symptoms appear is not because we're crazy. It's because what happened or what we saw was just too much to process at the time, too terrifying or overwhelming for our nervous system, either because we were, in the case of a child, we were too young. We don't have the maturity, the mature mental framework to make sense of what happened or get debriefing on what happened. And, in other cases with adults, it just is too devastating with respect to the emotional and spiritual resources that we had at the time. And one of the main things trauma does is that it rattles our sense of self at the core, so that a person is left feeling shaken or lost or stuck in a way that makes it harder to function in daily life. From an acupuncturist perspective, trauma can create energetic blocks in the body. These blocks I'm talking about are clearly laid out in the 5-element acupuncture system by teachers such as Angela Hicks, Neil Gubinick, and J.R. Worsley. When these blocks are left untreated, they can be a real threat to a person's stability, mental, emotional, as well as physical well-being. The result of clearing these blocks is that a person can experience a significant improvement in their body, their mind, and their spirit. One of the first treatments that a 5-element acupuncturist will do to clear these blocks is a protocol called the Inner Dragon's Treatment. Now, the symbol of the dragon in China is a very benevolent energy. And we use this treatment when someone has been overpowered by an internal or external energy. A person will show signs of needing this when they have been experiencing disturbing dreams or have addictive behaviors, obsessions that they don't feel in control of, unusual thought or speech patterns, voices they hear in their mind. And often what is seen is the eyes. It can be difficult to make eye contact. It's like the eyes seem, in a way, covered over, where it's hard to feel like we've made contact, we've reached the person through our eye contact. It can also show up when a person doesn't really feel in control of their own actions. It feels like there's a sense of being stuck in a repetitive loop of negative thinking or a way of being that has gone on for a while. And this stuckness stops them from having a more diverse range of emotional expression. So the whole personal expression is kind of locked in, coming from a bad memory that is like haunting them in a sense. So there's a huge spectrum in how people experience trauma. And I'll tell you from my clinical experience, what I've noticed with patients is that when they receive this Inner Dragon's treatment, there's a definite strengthening of the person where, initially they may have had this emotional fragility about them, but from being shaken to their core by the trauma, and even though it may have been 20 years in the past, once they start receiving treatment, there's a sense of solidity, strengthening of the person happening once this gets cleared. And for some people, they will need just one treatment. Other people will need several treatments. It really depends upon other predisposing factors that I'm about to mention. And another way that we can see how this Inner Dragon treatment is working is that a patient stops obsessing about whatever they happen to be obsessing about, and they're able to just completely let it go and move on with their life. This type of block often shows up when there are certain predisposing factors in place. These are things like physical shocks or accidents, drug or alcohol abuse, being too energetically open to others without protection, which creates a sense of vulnerability. So by this, I'm referring to things like when people get involved in occult phenomena, like using Ouija boards, for example, just being too open to, anything that could come in. Other factors include poor physical health, psychological health. It can also come from emotional shocks from things in our environment, such as the loss of a loved one. So let's look at this Inner Dragon's treatment. So this is a 7-point protocol. The points we're using are conception vessel 15, stomach 25, stomach 32, and stomach 41. These stomach points are bilateral, so this total points used is 7. For today, I'm just really going to focus on conception vessel 15, because with this protocol, it's really an acupuncture protocol, so we need to do all the points together. But REM 15 is quite a powerful one for acupressure. Some of the functions that it does is it clears, calms, and strengthens the mind and the heart. It helps in many situations where there is unclear thinking. These include situations where there may be fits, mania, feeling very irritated by the sound of people's voices, manic depression, any kind of mental illness, excessive anxiety. And on a physical level, it also helps with palpitations and chest pain. So we're going to find this point on the sternum here. which is in the center of the chest. This point is located at the base of the xiphoid process, which looks like a little tail of a turtle dove just in between the ribs. Okay, so just giving a little bit of pressure on this point here. Okay. Now, another system that I also really like comes from an acupuncturist named C.T. Holman, who wrote a book called Treating Emotional Trauma with Chinese Medicine. And what he did was he broke down a process of healing from trauma into 3 stages. The first is basically getting a person out of shock by dealing with the scattering of the mind, using a set of points that helps to gather the energy back into the center of the body. And he also calls this a mothering treatment. The points that are used help us connect with the sense of the archetype of the universal mother, which is the point conception vessel 12, which is a powerful point for strengthening both our stomach energy, which is how we receive nurturance from our biological mother, as well as the archetype of the earth mother. So the points that he uses in this first stage are, the first one is called Yin Tong, which is the point between the eyebrows. You can see this image here. This point clears and calms the mind, and it's also a great point for improving sleep. Now, the next point we're going to look at is called Pericardium 6. So this point is found with the palms facing up on the inside of the wrist, just below the wrist crease. We're going to go 3 fingers, which is 2 sun, below the wrist crease here. And then you're going to go in between 2 tendons. Tendons feel kind of like hard wires. They're not bones, they're just tendons. They're kind of spongy. Some people have 2, some people have 3. Basically, you're going right in the center, in the middle of the forearm, between the tendons of palmaris longus and carpi radialis. This point functions to open the chest, and often when we have like an emotional holding pattern, we may get tightness in the chest. It also regulates the heart in case of palpitations. It calms the mind, harmonizes the stomach. It helps with a sense of panic, as well as nausea, loss of appetite. Now, so just applying some firm pressure into this point. So we can just go for a couple of minutes here on the left side, on the right side. And then the next point we're going to look at is called conception vessel 12. So this is along the same line as conception vessel 15 up here. And this point is on the anterior midline of the abdomen, and it's 4 sun above the umbilicus. An easier way to think about it is it's halfway between where the 2 ribs meet and the umbilicus. So we can find these 2 points and then just eyeball where is the halfway mark. This point treats all manner of digestive upsets, epigastric pain, vomiting, hiccup, acid regurgitation, distension, dyspepsia. As I said earlier, this point strengthens our stomach channel, and it connects us with the archetype of the Earth Mother, allowing us to access a feeling of mothering and nurturing, which is very helpful for stabilizing our mind. It's very soothing. Like a child that is, that's, looking for, it's looking for support, it's looking for nurturance, it turns to mom. So this is like returning to the inner mom. Okay, and this point also treats insomnia. And then finally, we're going to look at a point on the inner ankle called spleen 6. This is on the medial aspect of the lower leg. It's 3 sun above the medial malleolus. So that's 4 fingers above this high point of the ankle bone. And it's just halfway between the front of the ankle, the tibia, and the back of the ankle. This point treats spleen and stomach deficiency, diseases of the skin, hives, which are well known that hives show up when we're stressed about something. It's often a trigger. That also treats insomnia, dizziness. Dizziness can show up when we're in shock. Our shen is no longer anchored. It disturbs the flow of energy brain, causing rebellious chi up to the head, which either looks like heat or wind. And in the case of dizziness, this is an example of wind. Spleen 6 also nourishes the blood, invigorates the blood, and when the blood is strengthened, it soothes the shen, because the strong blood returns to the heart, which provides a physical anchoring of the mind into the heart. So this helps us with sleep. Often if we have insomnia, we might have it can be caused by a blood deficiency. Okay, so it helps center our mind in our heart, and this can help us feel more calm and centered. The other stages of trauma healing that he talks about after this first stage, he also talks about the second stage, which is soothing the trauma, or what he calls fathering. And this is where we're working with the governing vessel channel, which is also called the father channel on the body. And then the third stage, the final stage, is all about how to treat the individual symptoms of how that individual is presenting with trauma, their individual symptoms, how they experience trauma mentally, emotionally, and behaviorally. Okay, and then it's helpful to understand that as healing happens, it often happens in spirals. So we're going through life, we often revisit old issues that we've had in the past. It can be back pain, digestive problems, an emotional pattern, as the case may be. And when these symptoms come up again, each time we have an opportunity to reprocess the old material and come to a new way of looking at it in light of who we are at the present time. So once our system has achieved a state of calm and we can finally get our daily functioning back, then we can start to look at what these difficult events have taught us. Sometimes we reach a crisis point where it can feel so overwhelming that it's helpful to remember the words of, I really like this line in one of Rumi's. Rumi was a mystic poet. He said in one of his poems, he said, "There's a crack in everything. That's how the light gets in." And I think it's really helpful to look at the bumps in the road of life with this understanding that it's never perfect, and these difficulties we face are often how we find our inner light. Okay, so I hope that all of this offers you some hope and some practical tools to work with. And I wish you all the best in your healing journey. Thank you for joining me here, and I look forward to joining you again in another video.